Welcome. My name is Siobhan Carroll, and I'm your host today. Thanks for joining us. Enterprise Health is a healthcare-focused cybersecurity firm with an expertise in high-trust, NIST, and third-party risk management. Today's webinar will be focused on the paradigm shift in third-party risk management. Before we get started, I wanted to give you a couple of quick housekeeping tips. Throughout the webinar, we will keep all lines muted to prevent background sounds. If you have any questions that you would like our presenters to address, please chat them to me whenever you think of them, and our panelists will answer them at the end. There's a chat function along the bottom of your screen. After today's session, you'll receive an email from us. If you're interested in a copy of the slides, please let us know. With that, I'd like to introduce our panelists for today. Vikas, you want to change the?
Yes.
Great. Harrison Welsh is our senior security consultant, and he is one of our experts on the panel today. We also have Tim Dennis, our chief product officer. And then the third person will be Vikas Khosla, who's our chief digital health security officer. Vikas will act as our moderator for today's panel. Vikas, why don't you take it away?
Thank you, Siobhan. Appreciate it. And thank you, everybody, for joining us today. We're certainly very pleased to be joining you for this probably about a 30-minute discussion here around what we think is a really important and emerging topic as far as holistic risk management is concerned, focusing specifically on supply chain and third-party risk. So I'll cover some of the key topics that we'll be addressing today, primarily setting some context for the discussion around third-party and supply chain risk management by looking a little bit at the history of GRC and IRM and how we've sort of gotten to the point that we are at, as well as this concept of hyper-connected risks that I think probably resonate with everybody that's in charge of managing risk management and security programs, and why we believe we've really kind of reached an inflection point in the industry that our company has certainly evolved. People like Harrison, people like Tim are really sort of at the forefront in terms of thought leadership and how they're applying that to the offerings that we provide to our customers and what our customers are experiencing and how they're utilizing it as well. So we'll go through that, and we'll talk about some interesting concepts such as risk interoperability and risk normalization, which I think we're going to start to hear a lot more about as we move forward in the industry. And then we'll briefly go over our Blueprint Protect IRM platform, which now manifests a lot of the concepts that we'll be covering today. So we thought it was important to kind of just set the stage a little bit for the conversation, to go back as we think about risk management. Typically, the enablement of risk management has been through software platforms and primarily through GRCs, or governance, risk, and compliance platforms. And as many of you know, the history of GRCs really started in the early part of the 2000s. But it was really a concept that as a business process goes back generations, actually started in the 1800s with the Industrial Revolution, as businesses started to expand from single person ownership and through the Industrial Revolution into regional and national companies. There needed to be a way to disseminate policies and controls to regulate that business. And as that started to happen, the federal government started to enact various regulations as well. That proceeded into the 1900s, where we started to see the formation of the SEC and the Federal Reserve, various environmental protections, equal employment laws, and then, of course, something very relevant to all of us in healthcare, HIPAA, in 1996, which really was the impetus of a lot of the start of GRCs in healthcare as we know them today. And then going into the 2000s, we had Sarbanes-Oxley and, of course, HIPAA privacy and security rules, HITECH Act, and most recently, a change to HIPAA regulation with the HIPAA Safe Harbor, which is very much in line with the themes that we'll be covering today. One of the interesting things to note is that the IRM market really started, the GRC market really evolved into something that's now being called integrated risk management, which is a term that Gartner coined in 2017. And since that time, IRM as a share of the GRC market has grown pretty significantly. As we can see in 2020, it was $7.3 billion out of the total market. for GRCs and how they're evolving. And the way to kind of think about GRC and IRM is horizontal versus vertical. And one is not necessarily better or more preferred than the other. They really are meant to work together. Though a vertical focus, as we can see from the threat landscape today, is really key and important in solving some of the real sort of, real threats that exist out of the marketplace into the industry. So we talked a little bit about this being an inflection point, and IRM being sort of at the tip of the spear of being able to address this concept of hyper-connected risks. Businesses at this point have become so complex due to digital transformation, various competitive pressures, the shorter opportunity windows that businesses have to sort of seize on momentum within the market and the industry, the various proliferation of data and data flows that are very complex with cloud-based hosting being ubiquitous now, as well as still a myriad of other types of storage of healthcare data. And from a regulatory standpoint, we certainly see the shift from compliance to risk management. And as the pandemic and other recent phenomena have shown us, disruption is sort of the norm of the day. This is not what we experienced during COVID and during the pandemic and the disruption to the supply chains. We expect in various different forms and for different reasons to continue. So it's really important that that organizations, that businesses really become adept at how to deal with this concept of hyper-connected risk across both security, privacy, as well as what we'll focus on today primarily, which is supply chain or third-party risk. And one of the key starting points in all of this is really getting alignment throughout the organization. So with that, I want to actually bring in Tim Dennis, our Chief Product Officer, to talk a little bit about this concept of operating from the same playbook. And as you can tell, we're all big football fans here and selectively have chosen our favorite teams represented by the three of us here. But I want to bring Tim in because we know that we need, Tim, these solutions to address these emerging problems to be scalable, flexible, interoperable. And at Enterprise Health, we've sort of had this luxury over the last couple of years to be able to analyze the market, really think deeply about these issues, work with our customers and the security community at large to start to identify a roadmap of how we would start to tackle these things. But I know the alignment and using standards as a way to get everybody on the same playbook is something that's very near and dear to your heart and a concept that you really embrace. So maybe you can talk to us a little bit about this whole notion of getting everybody aligned first and foremost.
Yeah, sure. Thank you, Vikas, and welcome everybody. My name's Tim Dennis. As Vikas was mentioning, the way we are looking at things, and especially in the security realm, I'll say it, we've seen things evolve over the years, by way of our information security management practice group, our services team. We have assessors. We do all sorts of security related functions that likely you all are also executing in your local environments. And it has been apparent to us as we're looking for better ways to do things and bring things together that the analog here that I've used internally is just this. That's why Vikas is showing this slide, is that it's as if you have a highly honed group of professionals doing things in the security area, in this case, a football team. And it's as if your quarterback room, the quarterbacks are sitting there planning the game plan. They've got plays they want to run and they're coming up with their own nomenclature and how they go about planning, for a given opponent. You got your linemen, doing their practices by themselves, and the running backs and the wide receivers. And it's as if they don't have one consistent playbook necessarily that they're working from. They're all doing, their own jobs exceedingly well, but if they're not all using the same nomenclature, the same language, evaluating things, like what the opponent's doing, the game situation, what have you, then what you have is, obviously potentially chaos, right? You're doing things, it's making you feel like you're doing something, but you're not necessarily going to get the results that you're expecting or that others, stakeholders are expecting from all the money, from all the resources, from all the effort that we're putting collectively into these programs. So you can go to the next slide, Costa. So this is where I see, the industry as a whole is looking, whether it's NIST frameworks or what have you. But obviously, there's a lot of realization that we're spending an awful lot of money in security, and in a lot of cases we're failing. I don't say that we're doing, we're all collectively failing, but there's a lot of bad actors out there. There's, every day there's more vulnerabilities discovered, and and it seems we're doing, more and more and not necessarily improving our security posture, right? So with that, the U.S. government, as a matter of fact, has recognized this. They're, I spent 25 years in the military myself, so I have lived this world, and we know there's adversaries out there, and that as you get larger and you're doing more and more things, the potential for disruption is greater and greater until somebody says, okay, stop it. We're going to find a better way. We're going to harmonize our activities. We're going to unify what we're doing. And that's what the government has done, through NIST, through presidential order. They've now requiring all U.S. agencies to adopt a standard framework, a standard set of methodologies, and even data models, so that we can get our hands around on the federal level. And we know how that works. We know how things trickle down, whether it's, from CMS, with Medicare, Medicaid initiatives that turn into, meaningful use requirements, now that all health systems and providers are required to adhere to. Likewise, we expect the same sorts of processes and requirements that the government's putting on themselves, their agencies and their suppliers, their third parties, their supply chain vendors, to all adhere to a standard set of methodologies by way of risk management here. So with NIST RMF 2.0, which came out a little over going on 2 years now, the government is trying to do a few good things. First off, they're marrying the concept of cyber risk with privacy, and also now marrying that collection with recognizing that supply chain, your suppliers are the ones who are likely doing a large part of your mission executing vital capacity for you, yet they weren't necessarily included well or clearly in the processes that the government was requiring through FISMA, GSA, what have you. So under 2.0, they've kind of recognized that, they've tightened that up, brought all that together, security, privacy, and supply chain. They've also improved, recognized their process here that was kind of lacking up front, what we call the prepare step. So they overtly added a step here, they call it step 0, because they had a 6-step process before, which really helps them better kind of normalize the things that you're managing, the systems that you're managing, defining what they are, how we assess them, going forward, and try to make them, more repeatable and understandable. So we've added some more steps. We've clarified, this RMF model. Now it's 7 steps if you count, step 0. And then they've said, okay, so now we've got, a good methodology. We're going to require all our agencies to do something, that is standards, but we're missing something, right? So you'll see that there's been some evolution of, this special publications, around the outer edge of that circle there that you see there, 800, 30, 37, 600s, all of those things coming together. 853, Rev 5 just came out, adding the privacy control. So all of those things are moving the ball forward. But again, it's just more regulations, it's more documentation that is helpful, but it wasn't, all that it was necessary to bring it together. So if you go to the next slide here, Vikas, in the interest of kind of moving forward, what they've added also along with RMF 2.0 is this notion of, providing tools, a standard data set, a data model that supports the 7 steps I just showed before, a methodology, all with interoperable, risk assessment and management processes that you see here on this screen, right out in NIST. So it helps folks like us who are designing software, helps folks like you all likely on the receiving end of this, or how do I best execute this in the most efficient manner and then also make it scalable across my organization. Because for larger organizations, they have specialists, that are either monitoring their networks or executing internal security risk assessments or executing a phishing campaign or assessing third parties, right? Which we're talking about today largely. And so the problem is, they're all individuals. They kind of all have their own best practice methodologies. They're identifying risks, but there's no way to bring them together. There's certainly no way to kind of leverage, my resources across my organization in a way that I can have confidence that we're doing things the same way, we're evaluating risks, so that in the end I can look across my domain, all my different security areas, and know where to apply my scarce resources, my monies, what organizational elements, what supply chain vendors, what processes present the highest level of risk that I should be paying attention to. So the goal here with OSCAL, Open Security Controls and Assessment Language, which NIST is aiming to, or they're advertising that it's going to go GA here in April, is a release of this standard set of data model and eventually some tools to help facilitate the complete end-to-end life cycle of assessing, identifying what a system has in it, what the potential impact is of that system to you as an organization and other systems it's connected to, evaluating the controls that you've identified should be in place for their effectiveness and completeness and accuracy, assessing any gaps in your policies and procedures for that system, and then assessing the risk that's associated with any vulnerabilities or findings you have. And then wash, rinse, repeat, monitor this ongoing as things change, add new modules, add new versions, what have you. So they recognize this is a really onerous process for folks like us, for folks like you, to manage and operate on a day-to-day basis without a standard set of nomenclature and tools to help facilitate this. So look for this OSCAL tool to come out and start seeing the ripple effect downwards to third parties, vendors, and applications that deal in risk management to help adopt this thing and then help kind of move the needle forward, in my opinion, to start realizing some of the efficiency gains that are just not possible, quite frankly, today when you have proprietary systems doing it in their own manner. A lot of them are all they're all for the right purpose, but without everybody using the same approach. Back to that first slide with the receivers and the running backs and the quarterback, all trying to do things to the best of their abilities, but not all from the same playbook. This is the playbook that we should all be looking towards to say, how do we adopt this in the processes I use, in the systems that I'm adopting to help manage the process, so that in the end I can look at my my systems all like for like, whether they're processes and people or hardware, software, and determine where's my true risk and what should I be paying attention to. Okay.
Well, Tim, thank you for that. That's really, and we do have a question that's, I think, related to this particular topic and to the points that are kind of on this slide here as well. But before we get to that, I did want to mention that, it's not only just NIST that's doing this, and we talked about the prepare step and that being a new component to it. So the methodology of how we do this and create this sort of XY matrix of horizontal and vertical risk management. But HITRUST has their new, the CSF version 10.0 is coming out in April. They're incorporating a similar kind of a process change as well as ISO 31000 for international organizations. So it's not only just US, but it's also globally frameworks. Some of the leading frameworks that are out there are also introducing that sort of a step ahead of when you jump right in to really make sure that you're well coordinated across the organization from a risk management standpoint. But the question that came in, and Tim, Harrison, both of you feel free to answer this. So we certainly talked about the benefits of standardization, but the question was really more around what are the pitfalls of using standardized questionnaires like a SIG. So maybe you can think about that a little bit. And I know that we certainly want questions, but we want to be mindful of time here as well. But I think, and maybe I'll take the first shot at that. And if you guys have anything to add, then you can certainly do that. But I think from a pitfall standpoint, the potential there is, of course, when you standardize and normalize, that you lose flexibility. But what we know we need going forward, and I think the concept of integrated risk management really seeks to do this, is that we need scalability. We certainly also need flexibility. Organizations, as we have experienced, have their own individual sort of risk profiles and things that they're really concerned about, a lot of times because of things that have directly happened to them, whether it was a certain type of breach or a particular high level of risk across their third parties, say. But there is, and if we have time at the end, we can talk more about that. I know Tim, you and Harrison definitely talk more about that. But the concept of flexibility, how do we make sure that we can also make these things specific to an organization's needs? But I do think though that the benefits of normalizing and standardizing certainly, I think, present a lot more benefit, a lot more positives than I think what sort of an open do-it-yourself kind of an approach as well. So in terms of adopting an IRM approach or transforming towards IRM, Tim, you and I talked about what are a couple of things that we can do. We know adopting a framework is one of the key components here, and we're seeing that happening really at a very extreme scale across the industry. But maybe you can hit on these next couple of points here too, real quick, around training and different things that organizations can start to do to try to take an IRM approach.
Yeah, sure, certainly. So, kind of going back, harkening back to those slides about, the process, standardizing that process, that's really, to me, where the opportunity lays as far as, having, interoperable people, that understand, that the playbook. And so from training perspective, there's a lot of resources out there. So if you're adopting, say, the NIST framework, there's obviously lots of reference material out there. As I mentioned, NIST is really kind of going hard to the hoop, pardon my analogy there, but on trying to, make sure every piece of education, every tool they provide is all aligned, from a, normalized language and methodologies. So to me, that's where, it all starts with your people who are executing, or your consultants, your service providers who are also helping you with your security program, is to make sure that they are also adopting that same framework methodology. So things that are presented to you as artifacts, output of any sort of effort, whether it's a phishing campaign and findings, somebody's reporting CVEs for your third-party systems, or your internal security risk assessments, however they are done, they're reported in the same standard methodology. And so people who are executing those programs are following the same standard approach.
Terrific. And Harrison, I know that you've had some very relevant experience very recently with an implementation of our software product for customers. Obviously, our product has been built on NIST and NIST RMF. But maybe you can talk a little bit about your experiences and sort of what are the benefits, some of the benefits that our clients are hoping to realize as they start to deploy these tools.
Sure. Yeah. Thanks, Vikas. Everyone, nice to be here talking with you guys. This is Harrison speaking. But yeah, so I have a lot of interaction with a lot of our clients who are experiencing a lot of challenges, and some of those challenges we'll talk about very soon. But more or less, right now, they're assessing their information systems and their third parties, but basically coming up with a risk level based on very few factors. As Vikas just mentioned, our platform, since it is rooted in NIST RMF, we now have the ability to allow customers to better assess their risks depending on how the RMF provides that guideline, and how it integrates. They can assess the risk and how it based on the information system and how that information system integrates into their environment. So our platform is tailors a impact level that's customizable, really depending on the system. So there's a whole bunch of different functionality to really give a backbone, as you could say, to NIST RMF, or a backbone to the system, and provide more like a heavy hitting risk level rather than just assigning a risk level based on very few factors. So
Gotcha. And I know, we're going to talk a little bit more about, you're going to talk a little bit more about the customer experiences and really what you're seeing out there as you're working with the customers that are trying to address these third-party risks.
Yeah, so I mean, there's a lot of issues, and people on this call might be able to relate to it. But four key things that we've been noticing is, one, this whole process is extremely time consuming. Customers, or they have to deal with hundreds of different vendors, usually providing various different services. Those vendors interact with a whole bunch of different information, so it's hard to determine how often an assessment needs to be performed, or if really an assessment of that vendor needs to be performed at all. Usually this whole process is very manual process, as people on the call might be able to relate. It's very rooted in spreadsheets, managed by multiple individuals separately. There could be emails back and forth and managed in a very ad hoc type process. Usually and often there are only a few resources in the organization itself, that do have a full-time job, that have to do various other things in the organization. So it's really difficult to manage such an effort with such a small team, especially with going back to the fact that there are hundreds of different vendors that all interact in different ways with different services and with different kinds of information. And then the one last challenge I wanted to point out is the fact that in the event of a major health crisis, such as COVID-19, for example, what if you need to go and implement a new solution which could help maybe address the fight, or provide some sort of a benefit to individuals affected by a nationwide pandemic? Well, that system that it needs to be set up very fast also could provide potential security risks. So it would be extremely important in performing an assessment against those solutions. So that would become an utmost priority. But with all these other challenges and having to manage your day-to-day work, it's just difficult to be able to accelerate those assessments with this manual process. It's almost unachievable. And that kind of keys up what I want to talk about next, which Tim provided an excellent overview of NIST, RMF, and OSCAL, and how they really play a significant role in the TPRM process. But here I really just want to stress the importance of that by utilizing these standards, which the government put together to act as guidelines, is you can utilize them to really help your organization be compliant with things like HIPAA or HITECH or FSMA, for example. So with all we stressed a lot today about the importance of adopting a framework. We've said that many, many times. It's one of those key elements as part of this entire process. But by following a framework, you can really standardize your TPRM process and ultimately create, and what I say here on the right is a centralized third-party repository to really streamline your program. So like I was saying in the challenges, there are hundreds of different vendors, and it's all managed in spreadsheets, and one department could be managing different vendors than another department. And it's really kind of a cluster of basically just a mess of different third parties. But by streamlining that into its own vendor repository, you kind of help eliminate some of those challenges and bring it to a central point. And now it's one thing I wanted to point out too, real quick before we jump on to the next slide, is that it's really a centralized list of third-party systems rather than third parties itself, because it's the systems that are at the center of this entire process, because it's the systems themselves that focus on your sensitive business practices and the sensitive information. But by utilizing standards to address compliance, you can build out this third-party repository, which is something that we've done as well as an organization to help address these issues. You can go on to the next one.
So I'm just gonna, I know this is a build slide, so I'm just gonna go ahead and put it out. I know we're gonna talk holistically about this concept of risk interoperability, which is related to risk rating. So Harrison, talk to us a little bit about this whole concept of this evolution of risk management and risk rating.
Yeah, so one thing I wanted to point out real quick, and as you see on the slide, there are many different, parts of the shield, right? There are system level risks, then there are third party, fourth and fifth party risks, and enterprise risk all the way up to, your functional areas, your organizational areas. So what's really important is key is to, utilize a framework to build out a unique risk profile, which stems to all different areas, and to evaluate risk at all levels rather than just because the risk at maybe the system level is going to be completely different than the risk at your enterprise level. So in order to really achieve risk and operability, the process really needs to be repeatable and sustainable and able to spread out to all parts of your organization. So this is some of my initial thoughts.
Thank you. And Tim, I know you often have thoughts on this whole concept, because you have to think about how to make this happen within the software. So any thoughts you'd like to share here?
Well, yeah, certainly that's where that OSCAL tool comes in. But, you know, just to kind of highlight a little bit, you know, back, you know, on this slide in what I didn't go into the details of the different components of OSCAL, but to what Harrison was speaking about, you know, the system level all the way up to enterprise level, is that for, you know, for an organization, a covered entity, for example, a provider organization, you know, they're required to comply with HIPAA, their BAs, you know, they're required to, you know, require their BAs to get that HIPAA compliance statement. And so as you kind of go through, you know, the exercise of that, you know, that's kind of the bare minimum, just require your BAs to say, yes, I am compliant, to collecting a security risk assessment. You know, to kind of answer a question, I think you were stating that something around the SIG earlier, Vikas, that kind of all fits in this because, you know, it all comes down to your organization, your risk posture, you know, what your appetite, you know, for risk is, and, you know, and how it fits into your mission, right? So if you're a large health system with a lot of patients, a lot of practices, you know, throughout a region, you know, multiple hospitals, perhaps, you know, that's going to look a little bit different than, you know, maybe a single doc practice, you know, where just kind of limited number of systems, right?
Yeah.
So depending on, you know, what your risk appetite is and your, you know, control of your vendors, you know, do you have a site picture as to, you know, do they all have a current security risk assessment? You know, in my opinion, you know, that's the bare minimum. You have to do that. And it's surprising to us as we kind of talk with potential clients, they don't even really feel comfortable that they have a good list of their vendors and what they, you know, what systems that are in place, what versions, what modules are enabled. But that OSCAL model and the risk, you know, management framework methodology, again, our system, you know, helps you collect this information along the way, helps you identify for each system, you know, a secure, you know, system security plan, not just already saying, hey, here's my SIG, I've answered some questions, but really, as we know, it's the implementation that's unique for each client, for each organization, what modules are implemented, you know, where is it hosted? Is it local? Is it in the cloud? If it's software like that. And then also evaluating, you know, then you are evaluating, you know, the controls that the vendor says you should have or are possible to be turned on, you know, you're evaluating the effectiveness, et cetera. So that's really how that all rolls together in that picture that we were looking at, to say, it's not just, do I know who my third parties are and do I have something that says that they're compliant? How do I know how it affects my entire system, all the other systems that support one level of an organization, and how it rolls up to the enterprise?
Well, terrific. Thank you so much, Tim and Harrison. I appreciate that. And certainly, you know, we wanted to end it with sort of this view that hopefully visualizes how it all comes together, as Tim mentioned, and the different components and ways that they can do it. So whether it's a Blueprint Protect IRM platform, or you're seeking a different solution or building it yourself, we do kind of see these components, this being sort of a blueprint, for lack of a better term here, how you bring, you know, put all of this together. So one last question before we end it. I know we're over time already, but one last question is, in terms of portfolio management, specifically around third-party risk, and Tim or Harrison, either one of you can take this particular question. How do you go about making sure your policies are really truly being enforced? We know that's one of the most difficult things, is to make sure that in the implementation, the day-to-day work of managing risk, assessing risk, that we're staying true to the organizational policies and procedures, and that we're following them so that we do achieve compliance as well as security. And there is this sort of holistic approach. So as we think about RMF and OSCAL and these new sort of standards and tools that we have, how do we connect it at that policy and procedure level as well? Tim, do you want to take a shot at that?
Yep. Thanks, Vikas. So to me, it all goes back to, just, like I said, every organization has a different, risk appetite, level of complexity, number of systems, right, all feeding it. So in the case of third party, that's a really good point, is that you can just ask for, once you have your list of vendors and, when's the last security risk assessment and give us the report, and it's basically self-reported, no validation. So by marrying all this stuff together, and if you have a true third-party risk management program and a tool that helps you manage your third parties, identify the systems, part of that assessment of that vendor system is the implementation of it, and that's how it ties back to your policies and procedures, because it doesn't really matter who the third party and system is, right? It's what part of the mission is it supporting, what's it touching in my organization, and how does that impact, my, whatever it is for how my handling of PHI, procedures for authenticating, authorizing users to a system, validating what information they should have access to, microsegmenting, for example, medical devices, has it been implemented correctly? That all ties back to what is your organization policy or procedure state you should do, and then evaluating that third party for the ability to support, what your policy or procedure says you need to get out of that system.
And I believe, correct me if I'm wrong, Tim, I believe OSCAL does support the automation of that as well, right? The adherence.
That's the vision, yes. So that you automate, you put in not just human readable, but machine readable language, your policies, your procedures, you define then for that type of system, the security support plan, systems security plan that is, and then you evaluate everything, whether the initial evaluation for the third party system that you're procuring to the implementation of it, and then follow on, monitoring of it.
Terrific. That's right. And it sounds amazing. I mean, somebody who's been doing this for such a long time, the ability to just that functionality alone, I'm glad the federal government is investing in these great tools for the industry. So with that, again, like I said, I know we're over time. I thank you both, Tim and Harrison, for your contributions today. Certainly great, thought-provoking and sort of innovation-focused content here. Hopefully our audience got something that they can take away out of this. Please contact us if you have any information, any additional questions. We'd be happy to connect with you and discuss any and everything related to this or any other topic that you find of interest. So thank you again today. And with that, I think our presentation has come to an end.
All right, thank you. Great.
Thanks, Vikas. Thanks, everyone.
All right, take care, Harry. Take care, Tim.